Good evening, everyone, and thank you for tuning in to Hotline 21 on CAN TV. This is a live call-in show, so feel free to dial us up at any time throughout our 25 minutes. My name is Jenny Brandhorst, and with me this evening is Stephanie Gutierrez. We are from Beacon Therapeutic. Beacon Therapeutic has been around since 1968, and what we do is provide mental health services, and I'm going to put some information up. Mental health services, educational services for families and children who are at risk. We have 4 locations, and our administrative office is located in the Beverly community at 1912 West 103rd Street. We also have homeless outreach services, and that location is at Western 11740 Southwestern, and we have 2 therapeutic day schools, a high school, and also our Longwood campus. And you can contact those numbers if you need to reach anyone in the particular areas. We are also on Facebook and YouTube, and you can look for us on the web at www.beacon-therapeutic.org. Now, with me tonight is Stephanie Gutierrez, and she's going to talk about one of our specific programs called CHIPRA. And Stephanie, let's just start off by you telling us a little bit about yourself, and then we're going to jump into the CHIPRA program.
Sure. I recently graduated from the University of Chicago with a psychology degree and another degree in human development. So I was really familiar with the different organizations out in Chicago, but I really wanted to get my hands dirty, so to speak, and work for an organization that put theoretical into practice. So I was able to find Beacon Therapeutic, and it seemed like such a great fit from all the past internships that I've done with non-for-profit organizations. So it was a great fit, and I'm happy to be a part of Beacon.
And we're happy to have you here. And speaking of programs, we are going to focus on our CHIPRA program, but let me just first give a shout out to our other programs and services offered at Beacon. Again, I mentioned we have 2 therapeutic day schools. We also do homeless outreach services. We do early Head Start. We do CHIPRA, which we're going to focus on tonight, and that's all kids health insurance. We also have a family assertive community treatment program, little/big intensive outpatient program, our 100,000 homes campaign, and our outpatient services. And so what we're highlighting tonight is our CHIPRA program, and Stephanie is one of the case managers in our CHIPRA program, who I understand is doing an excellent job with her duties with the program. So let's learn a little bit about CHIPRA. First of all, what is CHIPRA? And let's learn about the program and services.
Sure. Well, CHIPRA is actually an acronym for Children's Health Insurance Program Reauthorization Act, which is a mouthful, but basically it's a grant that was really placed to go out into the community and outreach to the different populations who are eligible for the medical card and all kids insurance, but for some reason haven't accessed it through the local office for whatever reason. Either they didn't know the requirements or they didn't know that they were eligible. So we really go into the community and try to find those different gaps in the people who have fallen through the health insurance program. So that's a little bit about CHIPRA. What we do...
Can I just interject real quick? Have a lot of people fallen through the cracks? I'm guessing yes. You're seeing a lot of...
We have... Illinois actually has a really high rate for families who are insured, but we are actually the 8th worst in the country when it comes to teen populations being covered. So again, either teens don't know that they're eligible, or they don't see a need for the health benefits. So we really try to emphasize how important it is to be covered, and this public benefit that can help them go to the doctor regularly, see the dentist, get vision, and also they cover different specialties that the teen might need. So everything under the sun that they could qualify for.
That's a lot. You've got a lot you got a lot going on there. So what's the difference between CHIPRA and All Kids? I know there's some confusion with that.
Sure. Well, All Kids is actually, we can think of it as an umbrella term. All Kids is the general name for the health insurance in Illinois. And under that big umbrella are 4 different subsets. So we have CHIPRA, which is families who make a higher income, they'd have to pay a small monthly premium, so that would be CHIPRA. Another subset is the family care. So if the family makes a low enough income for the different requirements, the parents could also qualify without any monthly premiums. And we have another program also called Moms and Babies, and this is specifically geared towards pregnant teens who might be 19, so they wouldn't be eligible for the age qualifications. But if they're pregnant, then they can qualify for the Moms and Babies, and that takes care of all the doctor needs that they might need to visit, ultrasounds, things like that. And
take a breath. That's a lot. That's a lot. We're covering a lot, and helping people do a lot. And for those of you who are watching us, I'm going to put up some contact information about our CHIPRA program, which is what we're talking about. And we've got Stephanie Gutierrez who is with us. Again, CHIPRA stands for Children's Health Insurance Program Reauthorization Act. It's an outreach program funded through a federal grant targeting in-need children, families, and adolescents in Chicago who are without health coverage. Now, if you want to get more information about this program through Beacon, contact our supervisor. Her name is Marge Dunn. She's a lovely lady. Her phone number is 773-233-3821. And right now with us, we have another expert, Stephanie Gutierrez, who's on the CHIPRA team, and she's talking about the many services involved with CHIPRA, with all kids, who's eligible, who's doing what, who can do what, and it's a lot. And for those of you out there, I, for one, take healthcare as a blessing. I'm blessed to have healthcare. I know many people do not have it. I'm sure you've seen a lot of cases. Can you tell the viewers about some of the cases you've seen and maybe some success stories? Or
Sure. We have, like I said, we have a program called Moms and Babies where pregnant teens are covered. So a lot of the time when we go out into shelters or teens who are living at home, we'll see that sometimes they were afraid to take their kid into the hospital who had small flu because they didn't want the bill from the emergency room. So with this program, they can go in regularly and check up on their kid and make sure that he's doing fine and it doesn't get progressively worse. And we've seen a lot of cases where something could have been prevented, where a child has been sick and it's just gone progressively worse because they were afraid to go into the emergency room and have that big bill to pay afterwards.
Wow. That's pretty intense. And Stephanie, I know we've got a lot of questions we need to cover, a lot of ground we want to cover. CHIPRA is it's a federal grant. Like I said before, I'm going to put the funding information up because I believe we had a caller who maybe doesn't want to be on the air, maybe wants to remain anonymous, and that's fine. So here again, CHIPRA is the Children's Health Insurance Program. It's Reauthorization Act, and it's a federal grant. And so Beacon was awarded this grant. It's a 2-year grant, and with that funding, we are able to do lots of things, help lots of people, and that's why Stephanie Gutierrez is with us to tell us more and to educate the viewers about how, if you do not have insurance, you can get it through CHIPRA. And Stephanie, let's move on to a specific topic with teens who do not have health care. That seems to be a growing trend. Can you talk more about that?
Sure. So teens actually probably don't know that they can qualify if they're not living at home. They might think that if they're bouncing from couch to couch or if they're living with their auntie and they're not living at home, that they can't qualify. But in fact, they can. Up until their 19th birthday, a teen can qualify for this program. And all they really need is a form of identification. And if they're working, we just need the most recent pay stub, and that's all we need. So it's very simple, and unfortunately, a lot of, like I said before, Illinois, for some reason, a lot of teens are slipping through the cracks with the medical coverage. So we really are trying to reach the teens. This is a great program. It can, during adolescence, it's a very important time for teens to learn how to start taking care of themselves, how to be healthy, and how to prevent certain infections. So with this medical card, they can go into the doctor, start taking care of themselves regularly, and really start learning to be adults. And one of the questions that we get from teens is if they don't have an immigration status, can they still apply? And the question is yes, they can. All kids covers all kids, depending on the parent's income, of course, but that's the only thing that they take into consideration. They don't take into consideration the immigration status or prior health problems that they've had.
And that's good, because that could be very scary for someone. And I know you speak a couple languages, so I'm guessing that helps engage a lot of people who maybe are afraid. You speak Spanish, correct?
Yes.
So to reach out to that community and to help engage people in that particular population who may be afraid to ask for services, or maybe they don't even know what they qualify for.
Sure. And, Chicago is a very multicultural city, like we all know, and sometimes a lot of the information gets lost in translation. Sometimes some information gets flipped around and word of mouth spreads with the wrong information. So luckily we were, I was able to go out and really reassure people that if they do apply for this program, their information isn't sent outside. It remains within the Illinois.
Confidential.
It's confidential. There's no cross match, or none of their information is sent over to Immigration Naturalization Services at all. Again, it's very confidential, and the kids will be able to receive benefits, but unfortunately, the parents won't be able to receive benefits. But it's all for the kids and making sure that they get all the attention that they need.
And the care that they need. And thank you for that. And again, for those of you just tuning in, this is Beacon Therapeutic. We're live with Stephanie Gutierrez, and she's talking about health insurance for teens, young children, families. And this is a call-in show, and we've got a call now.
Question, ladies. Even though this is a federally funded program, isn't there certain services and certain procedures that's not covered? Because a lot of different programs have felt a lot of different budget cuts, and this made it fell to the axe as well.
Okay, that's a good question. Do you want to take that, or shall I?
Sure. Well, this federal grant actually is only for the application process. So what sometimes gets a little bit confusing about our program is that we help you receive the medical card and receive the benefits. But once you are approved, you have the option of picking different family plans or different care plans. And unfortunately, under those care plans, sometimes some things aren't covered. So you really have to make sure you're reading through the plans and make sure you pick one that's most appropriate for your family.
That's a great answer. And again, for those of you just tuning in, we are Beacon Therapeutic. We're talking about health insurance, the Children's Health Insurance Program Reauthorization Act. And this is a lot going on with this program. It's an outreach program funded through a federal grant. And we're targeting in-need children, families, and adolescents in Chicago who do not have health care coverage, which I'm guessing is a lot of people. If you want to contact us and want more information, Marge Dunn is that person. And if you are a visual person, this is Marge Dunn, who does an excellent job. She's on our CHIPRA team. And this is Marge with another CHIPRA team member, Brittany Ward. They're excellent resources. And I'm here live with another excellent resource, Stephanie Gutierrez, on our CHIPRA team. And again, thank you for being here, Stephanie. As we've mentioned many times in this show, there's a lot going on with CHIPRA, and we've talked about different services. Teens can apply on their own or with their families. What if a teen is living with a sibling or with an auntie or someone other than a parent?
Sure. Well, when you apply, you're actually applying as a household unit. So if the teen is living by himself or herself, she or he is only going to be counting themselves as a unit. So it'd only be one person applying. So a lot of times teens who are applying who are living on their own think that the application or approval process is going to take into consideration their parents' income. And that's not the case. When you're applying as a single household, they're only taking your income into consideration. So if they are living with their auntie, if they are living with their sibling, but they're only applying for themselves, the approval process is only going to consider their income and take into consideration their needs.
And I think you touched on this before, but I want to reiterate, why is it so important for teens to have health care coverage?
Well, during the adolescent phase, a lot of teens are learning how to take care of themselves, and one of those is going to a doctor regularly, seeing their dentist, getting any type of vision needs, vision services, or behavioral services that they might need. And during the teen years, we also have to be mindful that they have to keep up with their sexual well-being and prevention and all of those things. And the medical card really makes that all accessible to them.
I'm sorry, go ahead. Oh, no. I didn't mean to cut you off. Did you have anything else to say on that? Okay, great. And again, I want to show some pictures of Beacon does a lot of things. We have a lot of programs, and we're serving a lot of people. So we're serving families, children, infants, those who do not have a voice of their own, we're helping. And I just want to show some pictures because it helps put faces with these programs that we're implementing. So it just helps to see many people need our services and why Beacon is so important. And when you see these faces and so many other faces, it's how do you not want to help? How do you not want to be part of Beacon's mission and what we're doing, and learn more about what Stephanie is talking about with CHIPRA and helping families and children get health care coverage and the ins and outs of navigating that system. It's tough. It's tough for someone like me, who I consider, I was born and raised in the United States, and I have resources, I have a network, and it's tough for me. It's confusing for me. So how much more for someone who is young, who is a teen, or who does not have those resources? Sure. Stephanie, I want to ask about Illinois family care. Can you speak about that?
Sure. Family care. We talked about before about the umbrella of all kids. So all kids, you can think of it as an umbrella term for the general name for the Illinois health care. And under that, one of them is the family care, where the children qualify, but if the parents make a low enough income, the parents can also qualify through their children's coverage. So just to give you an idea, a lot of people think that perhaps they make too much money and won't be able to qualify, but the income bracket's actually really high. So for a family of, let's say, 3, the family can make up to $2,316 a month.
Wow. And
they wouldn't be paying any monthly premiums or any co-pays for their children. Wow. But another subset of that, of the umbrella, if the family of 3 makes a little bit more, let's say up to about $3,088, they would be paying a monthly premium, but it would still be pretty economical. It'd only be about $15 per child, and they would be capped off at $40 if they had 5 or more kids. Or I'm sorry, $40 if they had 5 or more kids.
Well, that's still good.
It's pretty economical. And while we're still under the umbrella of all kids, another program that a lot of people don't know about is the rebate program. So if your family is covered through a private insurance company, the state will help you pay for that private insurance if your income falls again within the bracket. So you can receive up to about $75 a month for every child to help pay for the private insurance. So I think it speaks volumes that Illinois really does take to heart that health insurance is very important, that even if you do receive it through a private insurance, they understand that it's very difficult to pay for, and they're willing to help with those payments.
You've been with the Beacon CHIPRA team for a few months now, and you've seen a lot, you've done a lot, you've learned a lot. What are some of the rewards that keep you going every day, keep you motivated?
Well, during these tough times, a lot of parents are struggling to make ends meet for their family, and it's really nice to know that I'm part of a program that at least gives the parents peace of mind that their children will have the medical attention that they need if anything were to go wrong. They know that they can go to the doctor and not fear that hospital bill. So it's really rewarding for me to know that I'm at least helping in that aspect.
Immigration. I want to go back to immigration. We touched upon this a little earlier, but I want to go back to that because it's such a hot topic. It's something that it's on the front burner with a lot of people, and if a child is not a U.S. citizen, they can still be eligible for CHIPRA. And I want to talk more about that. And I know you touched a little bit on it, but I really want to mote here because it's such a hot topic.
Sure, and sometimes a lot of this information gets flipped over backwards and the wrong information gets sent through. But like you said, if the child doesn't have an immigration status or is undocumented, they can still apply and they will qualify for the benefits, granted that their parents make the income within the bracket. So the child will qualify. Unfortunately, the parents won't qualify. But a lot of the times when people who are undocumented, they fear filling out the application because they think that their information is going to be sent elsewhere, somewhere where they can become a public charge. And
or do they feel that they will be deported or something?
Exactly. And that's just not the case. Once you do fill out the application, that information remains confidential and it stays within the department and nothing gets cross-matched. There's no need to fear that.
Okay, good. And I want to just put up some more pictures because, again, I'm a visual person and I want people to see, we're serving a variety of ethnic backgrounds, a variety of ages, a variety of family units. Beacon has a lot going on, and we're proud of the work we do. We're proud of our mission. We're proud of our staff. We're proud of our board of directors, our team. We've really are proud of the work we're doing in the community, and CHIPRA is one testament to the many good things we have going on. And I also just want to put up our mission statement. I know we mentioned it earlier, but what Beacon is about, we're about empowering children and families by helping them find their way to a better future. We provide accredited educational, mental health, and social services. And again, if you just tuned in, we're almost done with the show, but I want to put up some more contact information that you can jot down in case you want to reach us. We have 4 locations. And if you want to talk to Stephanie, who has been our guest this evening, she is part of the homeless outreach services at that facility, which is on Western, and that number is 773-233-3821. And Stephanie, we're talking about CHIPRA, and we've covered a gamut of things. Have I forgotten anything? Am I missing anything that you want to cover? Or do you have any final words for our viewers?
Well, one of the things that's really important about Beacon is that they help families who are in need and trying to get back on their feet. So I really encourage people to take Beacon take it seriously. We're trying to help families who perhaps haven't ever had to contact public assistance, who aren't familiar with the ins and outs. They never thought that they would need to service this. And it's really just important to consider that sometimes there is people in need and that we do need to help them and find the kindness of our hearts.
Well, I think especially, as you mentioned, in these difficult economic times, people who normally wouldn't turn to public assistance or a food bank or that type of thing, we're all a paycheck away, and no one's immune to needing services, and it's put the pride away. It's if you need help, ask for it, and we're here to help. We're Beacon Therapeutic, and this is where we're located. We've got a lot going on, and just to give testimony to that, these are just some of our programs and services that we're offering. So we hope you'll support us. We hope you'll call us if you need help. Stephanie, thank you so much for being a guest this evening. I appreciate it. I know our viewers have appreciated it. And we've got about a minute left. So what I want to do is put up some information about an upcoming event that Beacon will be participating in. And that is the 15th annual Wrigley Start Early Run. Join our team. It's not too late. It's this Saturday, April 21st. And it will be at 9 a.m. There's a 1-mile walk that I'll be participating in, and a 5K run and a 10K run, and that's in Grant Park downtown. So for more information, you can visit our website. I also want to alert viewers to another upcoming event, the Beacon Bash, which will be Thursday, July 26th. So save the date on your calendar for that. That's always a good time at Joe's Sports Bar on Weed Street from 6 to 9, and we'll have more information on that in shows to come. Stephanie, again, Thank you so much for being on the show. Thank you for tuning in. This is Beacon Therapeutic. We're on every Wednesday at 4:30. Please join us next week when we have the Executive Director from the Night Ministry, Melissa McGuire. Thank you and have a great evening.